Good evening and welcome back to Newsnight. Now, a health crisis is unfolding across South Africa as thousands of pets suffer from treatable adrenal disorders. The dispute between VTech, a leading veterinary pharmaceutical company, and the South African Health Products Regulatory Authority has led to the withholding of a life-saving drug called Trilostane. Despite a court ruling in October 2023 mandating cooperation, delays and misinformation have left veterinarians and pet owners without a solution. And joining us now to discuss this is VTech CEO, Dr. Johan Oosthuyse. Johan, thank you so much for joining us this evening. Please take us back to when the issue started. What happened to cause this delay in delivering this drug?
Yes, Melissa. So Trilostane is a chemical that was never called up for registration in South Africa. And that's the first thing that led to the confusion. So we've been using it for 5 years very successfully to treat adrenal gland disorder called Cushing's disease. And it's the only effective medication that can be used to treat this condition. And it's exclusively used to treat this particular condition in dogs and cats. So after having used it for 5 years, suddenly in 2023, last year, the authorities stopped a consignment of Trilostane at OR Tambo that was destined to be used in this treatment. We immediately consulted with the CEO of SAPRA and tried to resolve the matter, but we were not successful to do that and had to approach the court, which led to the court ruling where we were mandated to reach an agreement with SAPRA on the future use as an interim solution for that particular consignment.
Now, Johan, why do you think my apologies for interrupting you there. Why do you think that they are zoning into this drug specifically?
We're very confused about this, Melissa. And it's also not the only veterinary drug that is at the moment under scrutiny by SAPRA. We have a similar situation with a drug called Johan Oosthuyse, which is an antidote for game-carrying drugs. And there's also a lot of confusion about that particular medication. So in terms of the Trilostane, it really creates a crisis because there's no alternative that can be used to treat these animals. And we've approached them again to try and find a solution without success. And now we've resorted to approaching the Minister of Health to intervene in this matter.
What are the reasons that they're citing that they're stopping this drug coming to South Africa? Are they citing specific dangers?
Not in this case. We haven't been able to obtain any reason why this particular substance is stopped. In actual fact, it's not stopped. We've been, the drug is, or the medication has been released to us. We're just not allowed to use it now. And that's really what's the frustrating thing. The first consignment was in actual fact stopped, but I think with the court ruling, we've solved the confusion in that particular case. So we are sitting with the substance in our warehouse, ready to be used, but we've been instructed by SAPRA not to do so.
Now, you have went to court on the matter, but like you said, it hasn't been resolved yet. What is your next step now to get this medicine to cats and dogs and possibly other animals who really need it?
So we've, like I mentioned, approached the Minister of Health, asked him to intervene as a matter of urgency because there is no further supply of this particular medication in South Africa as far as we're aware. And we're waiting for his response. Unfortunately, you know, in a month and more than a month, we haven't had any feedback in this particular case. So we're really destitute at this stage.
Thank you so much for your time. That was Dr. Johan Oosthuyse, CEO of VTech. To this story now, 940 more police officers will be deployed to the Western Cape